All right. In this training, we're going to review how to position hospital indemnity plans for your Medicare Advantage clients. And in the training, we're going to cover who buys, help you understand and explain the risk to your clients. We'll walk through our process, how hospital indemnity plans work, and then we're going to wrap it up with how to quote a hospital indemnity plan with Bankers Fidelity. All right, so who should buy a hospital indemnity plan? Really, any Medicare beneficiary that's on a Medicare Advantage plan, and it's ideal for people just starting Medicare. If you've missed this opportunity to make a pitch, it's really ideal to also explain the benefits to your current clients while you're doing your retention calls during the Medicare annual enrollment. So let's talk about the way it works. So we know that Medicare Part A has a hospital deductible, and on average, a standard Medicare Advantage plan, right, is going to have a daily hospital copay between $250 and $375 per day. And an extended stay, we know as brokers, is going to lead to bills when that person leaves the hospital. The biggest mistake that I see with producers is that they think that a Medicare Advantage plan has to be zero premium and that you can't collect any premium and the plan has to be zero. The other thing that we see as a big mistake is you decide that your clients cannot afford to pay an additional premium for a hospital indemnity plan. And so this is kind of a mindset as producers we need to break. And then this is super obvious, but if you never bring up a hospital indemnity plan to your clients, you're never going to sell any. So whenever selling any ancillary products, right, you have to be educational focused. You have to explain how Medicare Part A works. If you don't do this, it's very difficult to sell a hospital indemnity plan, and you're really just slinging benefits. So as part of our core presentation, right, we're going to explain to people that if you go into a hospital, we know that Medicare has a deductible per benefit period, right? And with just straight Medicare, we know that the client's exposed to a $1,736 deductible. Now, if the client goes in the hospital multiple times, we know that benefit period is going to reset every 60 days. So if a client goes into a hospital 2 or 3 times in a year, right, you're talking about massive out-of-pocket bills. And most people don't fully understand how their Medicare Advantage plan works, and they do not want to get a surprise bill. So if you educate them up front about the exposures of Part A, right, it's much easier to offer a hospital indemnity plan. So at the core basis, right, a hospital indemnity plan simply fills in the gaps of a Medicare Advantage plan, and they have to be positioned side by side with how Medicare works and how their Medicare Advantage plan works. So, right, this selling ancillary products is a mindset and it's about preparation. So I feel, right, that Medicare Advantage and a hospital indemnity plan is the perfect combo, just like a Reese's peanut butter cup, right? And it's going to provide that financial protection to your clients should they enter a hospital. So as we've been, teaching our clients and educating our agents, right, selling ancillary coverage is part of a process. You never want to throw it in after you do your Medicare Advantage pitch. So our agents follow a 5-step process on every call. And the first part is simply going to be a warm-up, and you're going to do a needs assessment or a fact finder. You're going to ask a few questions about your client's medical history and current coverage. Then you're going to go through your education on how Medicare Part A and Part B work. You're going to walk through the exposures and the risks associated with Medicare Part A and Part B. Then you're going to explain the differences between Advantage and Supplement. After that, you're going to build bundles or packages of protection. And then you're going to give a quote, make a formal recommendation, and close the client, and you're going to email them the quotes and everything that you discussed. All right, so let's look at the warm-up, right? So this is a piece of the fact finder that our agency uses, right? So this is just a snippet of 5 questions. It can be longer, but whenever we start with a new client, we're going to ask them about their current coverage, how much they're paying, and are they aware of what their deductibles and co-pays are. So if they're coming on to Medicare, they're paying a premium and they're paying out-of-pocket costs. So if you know how much they're paying, right, then it's kind of easy to make a pitch on why they need to pay an additional premium for a hospital indemnity plan or a cancer plan or a short-term recovery care plan. So after we figure out what they're paying for their current coverage, we're going to ask them about their current health history. We're going to ask them about any chronic conditions, and we're going to ask about any recent hospitalizations or any family members that have struggled through a hospitalization. This sets your pitch up for the hospital indemnity plan, right? We also ask about cancer, heart attack, and strokes, rehabilitation, and if they have dental coverage. All of these questions set you up for success to offer hospital indemnity and other ancillary products. So after we go through our education, right, if they're going to buy a Medicare Advantage plan, right, we're going to show on this slide, right, why they want to add hospital indemnity to their Medicare Advantage plan. And so we're always using visuals with our clients to portray the message that we're delivering. So we're going in knowing that we're going to sell multiple policies to the client. And on average, our agents are placing around 50% to 70%, depending on their skill set, on adding in any of these ancillary products that you see on the bottom of the slide. But again, you have to be prepared and you have to have a presentation ready to offer ancillary products. All right, so let's take a little bit of a deeper dive into hospital indemnity plans. So we know that hospital indemnity plan is a specific type of insurance that provides coverage for the costs associated with a hospital stay. And in some states, right, you could add riders on for outpatient services that's going to pay directly to the policyholder. So they don't have to submit receipts, right? They're going to get a benefit based on the benefit that they choose. So we will have to submit a claim form that they were hospitalized, and then the insurance company is simply going to send them a check based on the policy that you wrote. We know that a hospital indemnity plan is a fantastic add-on to your client's Medicare Advantage plan. So again, during your education, we have to understand that a hospital indemnity plan is going to fill in the coverage gaps of what Medicare doesn't cover. And if you never explain the gaps in Medicare Part A, you're going to have a very difficult time explaining why a hospital indemnity plan is going to fill in those gaps. So, right, so we know that a hospital indemnity plan, your clients are going to get paid cash for every day that they're in a hospital. There's no deductibles, and they could use the benefits that they want. Key features, in many states, you can customize your options with multiple riders for hospital benefits, for hospital deductible, for hospital admission. And outside of New Jersey, like Pennsylvania, other states, right, you could add an ambulance rider in, an emergency rider in. Some hospital indemnity plans also allow you to add a cancer rider onto it. That's going to be state specific. Some of the carriers also offer guarantee issue without medical questions. It doesn't work that way in New Jersey, but some carriers do offer no medical questions with different carriers that we work with. All right. So what does Medicare Advantage do exceedingly well? Right. We know the strength of a Medicare Advantage plan is that the client is going to pay low or a monthly premium. We know that it bundles their medical and their prescriptions, gives you extra benefits, and it has an annual out-of-pocket maximum that protects them from the 20% that traditional Medicare doesn't cover. Right? So Medicare Advantage plan controls costs, but it does not eliminate them. It provides protections for out-of-pocket costs associated with everyday healthcare expenses. And as a person uses a Medicare Advantage plan, they're going to have everyday healthcare expenses. So turning 65 clients who are used to paying for their healthcare will add hospital indemnity or umbrella coverage if you provide a formal recommendation after you expose the hospital Part A exposures. Right? So we know that hospital indemnity plan really solves the Medicare Advantage out-of-pocket cost gap because it's going to cover hospital copays, certain riders on the Part B side. It offsets lost income. It helps protect savings, and it's going to work with any Medicare Advantage plan. So, hospital indemnity plan provides cash flow from surprise expenses. And we know from working with clients that clients have no idea how their benefits work, and they will get surprise bills after they're discharged from the hospital. So you have to be able to help your clients understand that when they leave the hospital on a Medicare Advantage plan, they are going to have bills, right? And these are some of the bills that we see from a standard 5-day hospital stay on a Medicare Advantage plan. So it's in your best interest to bring this up as a solution. So we never only sell a Medicare Advantage plan, right? Because number one, you're leaving money on the table, you're making less revenue per client, and you're not protecting your clients from Medicare Advantage major exposures. So at a minimum, we recommend everybody simply sell a Medicare Advantage plan, right? And a cancer, heart attack, and stroke policy. For this training, we're really focusing on hospital indemnity. But you can sell 3 products to a client here in New Jersey. You can sell a hospital indemnity plan and a cancer, heart attack, and stroke with the pitch. And in our last training, we went through cancer, heart attack, and stroke. So you guys can go back and watch that training. In other states where recovery care is available, right, you can also add a recovery care plan or a short-term care policy, and we'll cover that in an upcoming training. So one of the things that successful agents do well is that they simply explain things in simplistic ways, right? If you are giving your clients multiple options and confusing them, they're never going to buy ancillary coverage for them. So if you look at question 2 or power statement 2, I always say on a call is, hey, I never recommend a Medicare Advantage plan without umbrella coverage because it's going to provide protection for out-of-pocket costs associated with everyday healthcare expenses. So we always use these power statements to provide the opportunity, right, to add additional policies to your client's Medicare Advantage plan. And so keep it simple, expose the risk, make power statements, and provide the quote to add a Medicare Advantage plan to the hospital indemnity or vice versa. All right, so that's the basic pitch. I know I went through it quickly, but if you want these slides, reach out to Zaniette in our office, and we would be happy to provide those slides to give you a framework. All right, so for simplicity, what I'm going to do is I'm going to log into our Bankers Fidelity portal and simply show you guys how to quote a hospital indemnity plan. So with Bankers Fidelity, you have multiple products that you could choose. We're going to choose Bankers Fidelity Life. When we log in, we're going to go to eApps, eApplication Dashboard. New application. And we're simply going to put in a zip code, choose the application state, New Jersey, select the date of birth. Let's go with 09/01/1961. That's somebody who's turning 65. And then we'll go an effective date of September 1st, 2026. We're going to choose they're not applying for Medicare supplement period. Anything that's not asterisked, we do not need to fill out. It's going to ask you for confirmation. And then you're going to choose the products that you want to quote once the application loads. So for today's training, we're going to look at a hospital indemnity plan. All right. So this is going to be for an individual, or you could also do it for an individual and spouse. Maternity is automatically defaulted. And then we're going to choose included here. And then the great thing about the New Jersey application is that it allows you to do a hospital admission rider and a hospital confinement rider. right? So the hospital confinement rider maxes out at 250 days. And then the hospital admission, you could start off anywhere from $100 to $1,000. So if they're admitted, they could get a $500 admission benefit, and then they're going to get a $250 confinement benefit, and you can go all the way up to 31 days. So depending on the plan benefits, you could customize it for 7 days. After 7 days, we know most Medicare Advantage plans are going to cover you right at 100%. So if we don't want to select any of the optional benefit riders, we're going to hit requote, and the price is going to populate. So let's wait for it to populate. So now we're at $21.53. That's going to completely cover, right, that Medicare Advantage hospital copay. Now, $21, in my opinion, is relatively low, right? Our average premium is going to be, that we sell here, is going to be between $30 and $50. So we're going to add in the other riders. All right. So if they get confined or have any of these other items, the insurance company is simply going to pay that benefit directly to the client. So I'm going to hit requote, and the prices are going to populate below here. And again, I'm not going to give a client a choice here, right? I'm going to tell them it's about $40 for a hospital indemnity plan, and I'm going to send it to them, and I'm going to explain how it works. Now, if they say that $40 a month is too high, right, then we have options to simply lower that, right, and take some riders off, and then requote and get to a price where a client's more comfortable. I always feel it's in your best interest to provide a higher quote, and then if they say it's too expensive, you can always go down. So $35 should be affordable for most clients as long as they're not on Medicaid. So you can see, right, going from 300 or 300 to 1,000 doesn't really change the price all that much. And so typically, I would say, we're going to enroll you in the Medicare Advantage plan that includes your prescription benefits. And for about $40 to $50 a month, we're going to make sure that you're not exposed to that exposure should you be hospitalized. The great thing about the Bankers Fidelity portal is that you could pull up the sales brochure right here in the portal, and you can then email that brochure right to the client. And I always recommend sending it to them, and in the brochure it's going to explain what the benefits are, right? And so I'm not going to go through this for the sake of timing, but what I would do is let's see, some reason there's an error. After I'm done building out the quote, what I'm going to do is I'm going to create an email, and I'm going to email the client the cost. So I'm going to use my snipping tool. I'm going to snip this from the portal, and then I'm simply going to put it into the quote. Then I am going to take the brochure that I just downloaded and add that into the email. So now I have the brochure and the quote, and I'm just going to say, dear client, my recommendation is to go with XYZ Medicare Advantage plan, 0 premium, and we are going to add on the hospital indemnity plan to protect you from Part A hospital exposures. All right, I'm not a good typer. And then Medicare quotes. And then I'm simply going to send that to the client. I'm going to build my email while I'm talking to the client. I'm going to pitch them. It's about $40 a month. And then I'm going to read the medical questions to the client. Now in New Jersey, with Bankers Fidelity, there is going to be underwriting that you'll need to ask the client and ask them the medical questions that are on the application. So not everybody can get a hospital indemnity plan with Bankers Fidelity if they're sick or if they've been in the hospital. But we're going to want to get a list of medications and then ask them the questions that are on the app. So you always want to get a list of medications and find out, right, if they've recently been in the hospital. And then when you go through the app, you could actually ask the medical questions. And then on the underwriting guide, you'll see the benefits. So if you get a question on what's the ICU admission benefit, you could simply read it off to the client with the documents that are very easily accessible here in the portal. So let me know if you guys have any questions about how to add hospital indemnity. Like I said, we have slides that we would be happy to share with you. All right. Thanks so much for watching the video, and hopefully this provides a little bit of clarity on how to add hospital indemnity to all of your Medicare Advantage clients.